So there are several things that you can do both during pregnancy and during labor to try to reduce your chances of having a vaginal tear during birth, all of which I go into great detail in the vaginal tearing module of my online birth course. But for today, I just want to highlight one of those things, which is perineal massage. So what is perineal massage? Let's start by understanding what the perineum is. So I want to show you my model. This is my little pelvis model. At the bottom here, I have a vaginal opening, just to kind of give you a demonstration. So at the bottom of your vaginal opening is the skin called the perineum, and that skin connects your vagina to your anus. And if women tear during birth, that's usually where they tear, right? And so perineal massage is not a super relaxing kind of massage like you might be thinking. It's actually it can be a little bit uncomfortable for moms, and it's not something you have to do, but it certainly can help, and I'll explain to you how and why. So perineal massage is actually a manual stretching of that skin, and usually you'd use your thumbs and you'd go down into the perineum and stretch. So right down here at the base of your perineum, you'd hold the skin and stretch it, right? And you can do this every day, starting around 34 to 36 weeks. That's kind of what they suggest. And so if you want to see a more detailed hands-on instruction on how to do it, I would go to YouTube and do a quick search. There's lots of videos out there giving you a good idea of what that looks like. Now, the reason I want to explain it to you today is because I want to talk about how it relates to vaginal tearing. So ACOG is the American College of Obstetricians and Gynecologists, and per ACOG, perineal massage does reduce your chances of having a laceration during a vaginal birth. Laceration meaning AKA tear, right? And then there's also research out that shows that for first-time moms only, doing perineal massage can reduce your chances of needing an episiotomy. And if you remember, just a quick refresher, episiotomy is a surgical snip or cut of your vaginal tissue to open the opening a little bit more. And so if you're reducing your chances of needing an episiotomy and therefore reducing the risk of trauma to that area that would require stitches. So, what we can draw, the conclusion that we're drawing from that is that perineal massage has been shown to reduce vaginal trauma and tearing. Again, for more information on all things vaginal tearing and everything that can impact how much, if or whether you will tear or not, definitely check out my vaginal tearing module. It's in my online birth course. And know that you don't have to do all of the things to avoid tearing, right? Sometimes you pick and choose and take what suits you.